Welcome to COVID Talks. I have the pleasure to have with me today Dr. Xavier Deau. Dr. Deau is a past president of the World Medical Association and he is a family physician in Épinal, the capital of the French department of Lorraine. Good evening, Dr. Deau.
Good evening, Dr.
In France, the situation is already very critical. We have close to 150,000 confirmed cases of COVID-19 according to the Johns Hopkins University. And we have seen close to 18,000 deaths from COVID-19. You are practicing very close to the hotspot in France, the departments of Alsace and Lorraine. So what has been your experience with COVID-19 coming to your practice, to your family practice in Épinal?
Yes, of course, yes. You know, as you just say that the general situation is France is like a big disaster. More than 18,000 dead persons today. In addition, after 1 month of very strict lockdown, no signal and any tangible decrease, but since today, we can observe that there is less COVID in France in hospital. It's really a big disaster, very similar to Italy and Spain. Of course, in the east of France, where I work to date, there is 2,300 dead persons, 5,000 persons currently in the hospital, and 900 persons are in intensive care. And unfortunately, we know that 70% out of them are expected to die. It all started in mid-February, a cluster in an evangelist church, a celebration gathering 5,000 persons during 5 days in a row in the city of Mulhouse in the south of Alsace.
This has hit your region very hard with this cluster beginning around Mulhouse in the Alsace. How does that affect you as a family physician working in Épinal, in a city close by?
Yes, I saw the first persons with the flu. It was about the 25 February. And while examining patients, many flu symptoms appeared with alarming signals of loss of tasting and of sense of smell, as well as a deep asthenia. No tools were and are still not available to be able to confirm the diagnosis. No tests. The equipment was and is still very weak. No mask, no gloves, no safety equipment for anyone. It is really crazy to work in these conditions. Many questions arose at that time. What should I do? What should I do not? Where is my ethical duty of human being, doctor, father, and grandfather at home? For us, as doctors, it is not a role to criticize the French current measures. We are accountable. We need to work with conscience, determination, and commitment to save lives. It is our ultimate objective. The uncontrolled flow of information that is constantly looking for breaking news, sensations, and emotional impacts results in serious behavior disorder and distress. For example, I know a manager was convinced of catching the virus and closed himself in his cellar during 4 days. He was worried to contaminate his children. Another example was a young mother with a 6-month boy stopping breastfeeding in order to not contaminate a baby and myself subject to risks on the front line, really exposed to the virus? Is it really reasonable to continue to work with the risk of contaminating my spouse and my grandchildren confined with us? Or even more dangerous would be to contaminate innocently my patients. It is indeed very challenging to make the right decisions. I believe that it is my duty to keep working with the maximum prudence, care, and precaution. A good soldier has to win the war. A sailor never gives up. He never quits his boat. And, of course, God bless you.
In your family practice, what has changed since the corona epidemic came to Epinal? I guess it's no longer business as usual in your practice. What have you changed in your practice?
The rendezvous was completely different, and in my office, no COVID persons can meet normal patients. We have two offices different completely, and the way in my office was completely different. Then there is no risk contamination in my office. But the role of primary care is very challenging because we are on the front line. Working with no protection is very difficult. I saw the first COVID about the last week of February, and since that day, I have been taking care of more than 100 COVID patients. All my patients are terribly anxious, nervous, fearful, and are looking for hypothetical care. Beyond care, they are looking to invigorating and encouraging words that will support them to get back with serenity. This is essential for them to recover their personal and family balance in this lockdown period. At the end, the physiological support is as important care brought to them.
Xavier, what is the supply situation now? Is it still that bad as it was in the beginning, or is it now that you can get masks and gloves and gowns for your personal protection?
It's really better. We managed to have a mask with industrial, with factory, direct to the office pharmaceutical, and now I have gloves, I have masks, I have clothes, and now it's really better. But it's not from the healthcare authorities. Every physician managed directly with the environment.
In France, you are under very strict restrictions in normal life. So people have to stay at home. They are only allowed to go out either for shopping groceries.
That's right.
And if they have to go to work, there are very strong limits on sports and recreation.
That's it, yes.
How does that reflect, or is that reflected with your patients? Is that accepted? Do people understand these measures?
Yes, they understand, yes, and they respect the rules, but the people become very, very anxious because the rules are perhaps too strict.
Yes, France is one which has one of the strongest rules and the strictest enforcement on the rules there.
But okay, that's very strict, but we have no test to say you have the COVID or you have not the COVID.
Yeah.
And that's the big problem. I know that in Germany they have tests, and I think it's really good to have tests because now, today, I saw patients, the daughter, the father of the first patient 1 month ago. You understand? And that's a problem. Yes, the rules are strict, but if we have no test, it doesn't go really good.
One of the problems in your region was that the hospital capacity very early came to a limit.
Yes.
And in France, you had to move patients from the Grand Est to other regions in there. Was the capacity too low? Has there been too much savings on the healthcare system in the past, so that the healthcare system was not prepared for a pandemic?
Not prepared, absolutely. Yeah, the system was absolutely not prepared for such an epidemic. It has been a huge problem. The lack of preparation has got a huge cost, and we can see the dramatic impact. Too many deaths in the civil society as well in the medical staff. And it is not finished. Very hard for the moment to see any positive signals, really seeing positive signal, and any standard treatment. The lack of visibility is very worrying. As you say, as a reminder, in intensive care in France, we have got only 10,000 beds. And we know that ventilation medical support requires 16,000 beds. We are definitively short in bed in some geographic areas. Hence, the necessity to mobilize the entire infrastructure and move critical patients across the country and across Europe. 300 patients have been moved from Mulhouse to Germany. Thank you, German people. To Switzerland. Thank you, Swiss. To Luxembourg. And 2 other hospitals in France by equipped train and military planes.
What would you say has worked, and what would you like to see being much improved for a next situation of a catastrophe or pandemic or any other emergency?
I have no really good idea. The supply of personal protective equipment and COVID tests does not exist in France. I do hope a quick improvement and much more efficiency. We need protective equipment. We need COVID tests to improve the situation. But I have no idea to date because we have no test. However, the restrictions may have a significant social cost. Coming back to normal should be an evolving process, deeply thought and very well prepared from every single stakeholder in this crisis.
Dr. Deau, if you sum up, what are the positive and the negative experiences with the pandemic in France, in your region, in your office as a family physician?
The exceptional sanitary crisis will help people refocus on the essential and the human values of living together, with the emergence of true solidarity, fraternity, and generosity. The obsessive individualism of the last decades may diminish, and this is hopeful. The human being is closer to their family and devote themselves cultivate the value of love, solidarity for one another.
Dr. Deau, thank you very much for giving me this interview, and thank you for doing this in English.
Thank you, Otmar.
Thank you very much. Thank you.
Have a good night.